Glaucoma, protecting your sight by understanding types, symptoms, and treatment. Welcome back to Health Sphere. Our sense of sight is incredibly precious, yet conditions like glaucoma can silently threaten it. Glaucoma is a group of eye diseases that damage the optic nerve, the vital link between your eye and your brain. This damage is often caused by abnormally high pressure inside your eye, a condition known as intraocular pressure. If left untreated, glaucoma can lead to irreversible vision loss and even blindness. Understanding the different types of glaucoma, recognizing the subtle symptoms, and being aware of effective treatment options are crucial for preserving your vision. The main types of glaucoma: open angle versus angle closure. Glaucoma is broadly categorized based on the structure of the eye's drainage angle, the area where fluid drains out of the eye. The two primary types are open angle glaucoma and angle closure glaucoma. Open angle glaucoma. This is the most common form of glaucoma, accounting for the majority of cases. In open angle glaucoma, the drainage angle itself is open, but the trabecular meshwork, a spongy tissue within the angle that filters the fluid, doesn't function properly. This is often compared to a clogged drain. Fluid drains too slowly, causing pressure to build up gradually inside the eye. This gradual increase in IOP often causes no pain or noticeable symptoms in the early stages. Vision loss begins in the peripheral vision, and because the central vision is typically unaffected until later stages, individuals may not realize they have the disease until significant irreversible damage has occurred. This is why open-angle glaucoma is often called the silent thief of sight. Angle closure glaucoma. This type of glaucoma is less common, particularly in Western populations, but can be more dramatic in its presentation. Angle closure glaucoma occurs when the drainage angle between the iris and the cornea becomes narrow or blocked. This blockage can happen suddenly or gradually over time. Acute angle closure glaucoma. This is a medical emergency characterized by a sudden, sharp increase in IOP. It happens when the drainage angle is abruptly blocked, often due to the iris bulging forward. Symptoms are typically severe and rapid in onset. Chronic angle closure glaucoma. In this form, the angle narrows slowly, and the blockage may be intermittent or partial at first, leading to a more gradual increase in IOP. Symptoms may be less severe or even absent in the early stages, similar to open-angle glaucoma. Several factors can contribute to a narrow drainage angle, including the natural anatomy of the eye, age, certain medications, and certain medical conditions. Recognizing the symptoms. Different presentations. The symptoms of glaucoma vary depending on the type and whether the onset is acute or chronic. Open-angle glaucoma. As mentioned, this type is often asymptomatic in its early stages. As the disease progresses, symptoms may include gradual loss of peripheral vision. This often happens so slowly that the individual doesn't notice it. Tunnel vision in advanced stages, difficulty seeing in low light, tripping, or bumping into objects on the side. Acute angle closure glaucoma. This is an ocular emergency and presents with sudden, severe symptoms: severe eye pain, sudden blurred vision, seeing halos or colored rings around lights, redness of the eye, headache, nausea, and vomiting. If you experience these symptoms, seek immediate medical attention to prevent rapid and severe vision loss. Chronic angle closure glaucoma. Symptoms can be more subtle and may resemble those of open-angle glaucoma. Gradual loss of peripheral vision, occasional headaches or eye discomfort. Mild blurred vision, especially after activities that might dilate the pupils. It's important to note that some individuals can have glaucoma without elevated eye pressure. In these cases, damage to the optic nerve may be related to other factors, such as reduced blood flow to the optic nerve. Symptoms are similar to open-angle glaucoma, with gradual peripheral vision loss, because early symptoms of the most common type are often absent. Regular comprehensive eye exams are essential for early detection, especially for individuals at higher risk. Treatment to prevent vision loss. Lowering intraocular pressure. The primary goal of glaucoma treatment is to lower intraocular pressure to a level that prevents further damage to the optic nerve. While treatment cannot restore vision already lost, it can effectively slow or halt the progression of the disease. The choice of treatment depends on the type and severity of glaucoma, the individual's overall health, and their response to therapy. Treatment options include Medicated eye drops. These are typically the first line of treatment for open-angle glaucoma and are used to lower IOP, different types of eye. Drops work by either decreasing the production of aqueous humor or increasing its drainage. Prostaglandin analogs, often the first choice, they increase the outflow of fluid. Beta blockers reduce the production of fluid. Alpha-adrenergic agonists decrease fluid production and increase outflow. Carbonic anhydrase inhibitors decrease fluid production. Miotic or cholinergic agents increase fluid outflow by constricting the pupil. Consistency is key with eye drops. They must be used regularly as prescribed to effectively control IOP. Oral medications in some cases, particularly when eye drops alone are not sufficient to control IOP. Oral medications may be prescribed often for a short period. Laser therapy, laser treatments can be used for both open-angle and angle closure glaucoma. Selective laser trabeculoplasty, used for open-angle glaucoma. This laser procedure targets specific cells in the trabecular meshwork to improve fluid drainage. It's often an in-office procedure and can be an alternative or adjunct to eye drops. Laser peripheral iridotomy. This is the primary treatment for angle closure glaucoma. A laser is used to create a small hole in the iris, which helps to open the drainage angle by allowing fluid to flow more freely within the eye. This procedure can prevent acute angle closure attacks in individuals with narrow angles and is an emergency treatment for acute attacks. Cyclophotocoagulin. A laser is used to reduce the production of fluid in the eye. This is typically reserved for more severe cases of glaucoma. Surgery. When eye drops and laser therapy are not effective in controlling IOP, surgical procedures may be necessary. Trabeculectomy. This is a traditional surgical procedure that creates a new drainage pathway for fluid to leave the eye. Often referred to as a filtering surgery, glaucoma drainage devices, a small tube is implanted in the eye to help drain excess fluid to an external reservoir, where it is absorbed by the body. These are often used when trabeculectomy is not successful or is not the preferred option. Minimally invasive glaucoma surgery. A range of newer surgical procedures that use microscopic instruments and smaller incisions to improve fluid drainage. MIGS procedures often have a faster recovery time and fewer risks compared to traditional glaucoma surgery, and may be performed in conjunction with cataract surgery, preventing vision loss. The importance of early detection. Since open-angle glaucoma often has no early symptoms, regular comprehensive eye exams are the most effective way to detect the disease in its early stages. During a comprehensive eye exam, an ophthalmologist or optometrist will typically measure intraocular pressure, examine the drainage angle, examine the optic nerve for signs of damage, test peripheral vision, measure the thickness of the cornea. These tests, along with a review of your medical history and risk factors, help eye care professionals diagnose glaucoma and determine the best course of treatment. Individuals with higher risk factors, such as those over age 40, with a family history of glaucoma, of African, Asian, or Hispanic descent, or with certain medical conditions like diabetes or high blood pressure, should have regular comprehensive eye exams as recommended by their eye care professional. Living with glaucoma. A glaucoma diagnosis requires lifelong management and regular monitoring. Adhering to the prescribed treatment plan, attending follow-up appointments, and communicating any changes in vision or symptoms to your eye care professional are crucial for preserving your sight. While vision loss to glaucoma cannot be regained with early detection and consistent treatment, most people with glaucoma can maintain useful vision throughout their lives. Thank you for joining us on HealthSphere. Protect your precious sight by being informed about glaucoma and prioritizing regular eye care. This video provides general information and is not a substitute for professional medical advice. Always consult with your doctor or a care professional for diagnosis, treatment, and personalized recommendations regarding your health situation.